Hello, everyone. Welcome. I'm just letting a couple more people in through the lobby as we get settled in for this afternoon's webinar with Adele Hug. If you haven't met Adele before, Adele is an accredited practicing dietitian. She's got vast amounts of experience in the oncology nutrition space, and we're very grateful to have her with us. Before I hand you over to Adele, I just do want to open our meeting formally by acknowledging the traditional owners of the lands that we are on. I'm streaming here today from Whadjuk Noongar Boodja. If you are elsewhere in Australia or anywhere, I encourage you to also, in your heart, acknowledge the traditional owners of the lands, and we offer our respects collectively to the elders and to anyone who is present today who is Indigenous. So without any further ado, I hand you over to Adele Hug.
Lovely, thank you. Now let me just share my screen and then we can get started.
Oh, Adele, I did forget to say that if anyone has questions throughout the presentation, Adele will address the questions at the end.
So thank you very much for having me again at Breast Cancer Care WA. My name is Adele Hug and I'm an oncology dietitian. And today I'm going to be taking us through eating well during breast cancer treatment. I really wanted to thank the breast cancer support service that is offered here. It's such a privilege to be able to come and speak to you about nutrition, which is something that is really close to my heart, and I am privileged to be able to come and share some of my experience, knowledge, and some of the evidence to help support you or your loved one eat well during breast cancer treatment. So I'll just get started with a little bit about who I am. As Chandrika said, we've got the Q&A box, so please do add in there. What we'll do is we'll come to some of those questions at the end, as it's not something I can see alongside. And because we're talking about eating during cancer treatment, I just wanted to know if anyone's really noticing the food inflation costs. It can be an extra stress when you're trying to pick things to eat. So hopefully I'll be able to provide a few extra tips around that as you're undergoing any sort of breast cancer treatment. So I have quite a broad experience supporting people undergoing cancer treatment. The majority of that began in 2014 in the UK when I became a Macmillan oncology dietitian. And I was really lucky when I was there one of the first things that I supported was the moving forward after breast cancer treatment. So that was really where some of my experience grew, helping to support people with breast cancer, as it's not a common speciality among dietitians. So over that time, which is now 10 years, I've been digging deep into the evidence, and hopefully I can really share some of that with you to help you unpack what is going to work with yourself during treatment. I have some notes on my other screen here, so if I do flick across, that is why. I just want to make sure that I do tell you everything in today's session that I hoped to. So we're going to cover quite a lot today, so I will get started. But the session outline today is obviously on the left. We're talking about the pathway to treatment, actually what is eating well during cancer treatment for breast cancer, understanding malnutrition and nutrition impact symptoms. And I'll take you through a little bit of the sort of sciencey and clinical suggestions along there. So it can get a little bit lots of information, but hopefully you can pick and pull out what you need. And we're going to finish with a fact or fiction. So I've had a deep dive into a question that I get asked very often. And I also have another list of questions. So if we get time, we will get to some of those as well. I just put on the right here the other sessions because I will probably refer to them as we go through. We've already covered our prehab session. So if you're keen, please get in touch so that you can get sent the link for prehab. So prehab is preparing for treatment. And I'll refer to some of those principles today because actually they're really relevant at any phase of cancer treatment rather than just the before. So it is something that you might want to reflect on now that you understand a little bit more about what that might be in there. This is session 2, talking about eating well during treatment. The next session is going to be about after treatment and what that means. And then for anyone living with metastatic breast cancer, there'll be session 4, where I'll cover a few things in a little bit of a different lens. Everyone's journey to their breast cancer diagnosis is different. Many people will have actually felt quite normal up to a surprise diagnosis through one of our screening programs here in West Australia. Some people might have had another road to diagnosis, might be a recurrence, and they're back having some treatment. Everyone is going to be different, and that journey is very personal. Whilst you maybe, we categorize people within a grade and a stage, what that actually means for you is going to be very different. And nutrition is exactly the same. So what works for someone else might not work for yourself, and vice versa. This kind of goes against, or this is separate to how we run research studies. So I delve into a bit of research probably in the second half of this session in a little bit more detail. And the aim of research is to group people together and to test that things are firstly safe and feasible, and then to test that something might have a benefit. So they're obviously a little bit of a different focus. So I always do refer to evidence-based treatment that works alongside these sort of treatments that we give to people with breast cancer. But it is still an individual. You're going to have your own preferences and how things are going to work for you. Even just having a little deep dive into just how many different treatments there are for breast cancer, there are about 40 different types of chemotherapy regimens for a curative breast cancer regime, and about 45 for an incurable but treatable. And immunotherapy is creeping in there, so it's a more targeted treatment that comes with a whole nother set of nutrition impact symptoms, I suppose, that things that it can cause that can impact your nutritional intake. So there's a wide range of things, and these can cause lots of different symptoms and side effects as we go through. But what about some of the basics? So these few next slides are really taking us back to what is important to eat during cancer treatment. And these are some of the main points to include. And I'm kind of going to refer back to a few different types of eating patterns that are very similar. And there's a body of evidence that supports these sorts of eating during cancer treatment. One of the priorities, though, is actually food safety. So there used to be a bit more strict guidelines around eating with specific cancer treatments, specifically chemotherapy. But now we've reflected, and there's a little bit more evidence on it. And we really just promote safe eating food that is safe. So this really means following your best before dates, maybe a little bit more than you ever did before, making sure you're cooking things well, and reheating if you're using any leftovers so that they're very well cooked. So it's sort of stricter than you may be when you're looking at your food, your dates in the fridge, but to making sure you're having safe food. And that's to reduce the load of bacteria and foodborne illnesses. So you're more susceptible alongside treatment. So food safety is one of the pillars of eating well during cancer treatment. And the other thing is you're going to have, like I said before, those individual requirements that are going to suit you. You've got your own preferences, you've got your own allergy, you might have an allergy or an intolerance, or your family might want to eat a certain way, or you might have some religious needs that you cover with your eating. And that's going to definitely form part of what food choices that you make. So, you know, you do you when it comes to this, but there's some other key nutrients that we do want to include. We're going to have a little bit of a deep dive into these now. So protein is definitely top of the list. And if you'll probably hear me banging on about protein through each of the 4 sessions. Protein is really one of the forefronts to help strengthen not only our functional status, like our muscles and how we move, but how our immune system works. So it's a key to a lot of different processes within our body. And we know that requirements are higher during treatment and before treatment as well, and in the recovery phase. So we're looking at least 1 to 1.5 kilograms per body weight per day of protein. So there's quite a wide variety of protein foods to have. So it's picking and choosing what you like and what you find easier. You might notice there is soy on this list, which I often get asked about. And soy has quite a body of evidence behind it to being safe during breast cancer treatment. And actually, in some, as we move into after breast cancer, it's actually one of the foods that we promote. So if you do like soy, feel free to include it. The other thing, what was I going to say? The other thing that we are realizing is that if you are the easier choices for our body to absorb protein are animal based. So we're a little bit more relaxed on some of the traditional rules around moving towards plant-based eating during treatment. So if don't make any changes unless you want to, but including meat, fish, chicken, and dairy are actually easily absorbable products as long as you like them and you're not vegan or vegetarian, to be able to include some of those animal-based proteins. Obviously, vegetarians could include dairy if you're wanting to go down that route. When we're heading into session 3, about after breast cancer treatment, I'll probably do a deep dive into some of the evidence on veganism and plant-based diets after treatment. But during is not normally the time to consider making lots of different dietary changes unless you really, unless you want to, but don't feel that you have to. There can be lots of pressure for people to make changes during treatment, and actually it's not always the right time. If you're struggling to hit your protein needs, there's milk powder or other protein powders out there, and they can be another easy, convenient way for you to boost your protein intake if you feel that you need to, but you don't have to. If we move on to energy, energy is super important to make sure that we can carry on with our functions, help support fatigue management, and cope with recovery from treatment. So we've got a need for energy during treatment. It's a super important nutrient. It comes from fats and carbohydrates in our diet, and you'll see some crossover. Obviously, foods carry lots of different nutrients, but there's some really energy-dense foods, particularly fatty foods like nuts, nut butters, seeds, oils, avocado, those kind of things. You're going to get quite a body of energy from. There's also grains, bread, pasta, those types of foods, and beans, pulses, lentils that you'll get some energy from. So having a variety of these foods is really important as well to make sure that you're getting that energy that you need during your treatment. Another crossover, you'll see the pulses, lentils, and beans at the front again. So fibre or more plants is another good idea to add in during your treatment. So making sure you're hitting your fibre needs. So these are, again, similar products to what we've had before, more plants, whole grains, fruit and veg, herbs and spices. And I'll talk a little bit more about sort of some of the changes that might happen with this group as we move into if you're struggling with eating. But if you're eating well and wanting to include a little bit of a boost, this is a good place to start. We know fibre is super important for our gut health. We know there's a link and a growing link between how our gut works with our immune system, also with some of our hormones and some of the way our brain works. So it's a nice place to be able to nourish yourself with those foods. And it is similar foods that you're going to find to give you other nutrients as well. So it's hopefully something that you can add in. If it's something that you haven't had a lot of, make sure you do it slowly though, because our gut, especially during treatment, is a little bit more sensitive, and you don't want to go too far down the route where you might actually cause more wind and bloating that can feel quite uncomfortable. This is what our recommendations for fibre are. And so within a day, a couple of different meals is quite handy to add in that fibre. I've just realised I should have done a funky one of these for how much protein there is as well, but I've got another slide coming up on some protein-rich foods, because it's adding these two together to be able to show how much you need if you were to eat well during cancer treatment and managing well without many symptoms. It's the protein, the fibre, and the energy that you're looking for. I do have some other just easy suggestions here. It doesn't have to be big meals, even things like beans or eggs on toast, milkshake smoothies, those kind of things can be super easy, especially if you are treatment days or recovering from treatment, making sure that you are eating, because it's so important to get that energy in, and it can be so easy to miss a meal here and there when we're really not feeling like ourselves. So hopefully a few different suggestions there. What I'm going to deep dive into now is malnutrition. So many people do cope well with treatment, but for the majority of people, there'll be a moment where you are struggling with your eating, or at risk of struggling, or having different symptoms that are really impacting the way that you do eat. And because we know those important nutrients really do help support you during treatment, the focus on sort of especially dietetics during treatment is often around malnutrition. So we're going to have a little bit of a deep dive into here, what it is, why we worry about it, and some strategies to help if you are affected or worried about it at some point during your treatment. So there's lots of different types of malnutrition. So it's an umbrella term for where we have an inadequate intake of protein, energy, and micronutrients. So when it comes to cancer, you'll see this image on the right, yeah. There's lots of different complex pathways that are affected by cancer that can increase the risk of malnutrition. So it can affect our muscles, and it can make it harder for us to maintain our muscles. So we can still definitely build muscle during cancer treatment. So it is an extra focus, hence a lot of the messaging around high protein into our diets. There can be changes to the metabolism in our liver and our liver function. And that can be, it's a big glucose store for the body. So that's one of the things that can be disrupted, as well as sort of the pancreas and its insulin and function around there. It's usually the endocrine system, which is the inside system, which does our hormones, insulin and blood sugar control. But some people can actually get exocrine, which is our digestive enzymes issues there. The disease can also interfere with our gut microbiome. But the other thing that can happen is these changes can happen due to treatment. And this can affect us and cause different types of malnutrition. So they're listed on the left here, and often they actually overlap. So there is disease-related malnutrition, where someone has a disease, say cancer, and it causes some of these issues in their body that actually impact on their nutritional status. This can come with or without inflammation, where our body has a heightened sense of chronic inflammation. So it thinks that it needs this inflammatory state to release things, but actually in a chronic situation, it means that our body's normal functions where we're building often aren't able to be carried out. Sarcopenia is particularly muscle focused, where we lose strength in our muscles. And this includes our functional moving muscles, but also some of our muscles, like our lung function and things like that. So sarcopenia is another thing that we notice that can lead into cachexia, which is a specific cancer-related malnutrition where we lose muscle as well as fat mass. And it can cause, whilst it's treatable in the early stages, it can actually limit the ability for someone to have some treatment. And then we've got frailty, and frailty happens, doesn't necessarily have to happen, but often is associated as we get older. So as we age, our ability or our sort of muscle status often decreases, and it is a more challenge to keep it up. So we can be frail when someone starts treatment, and that can obviously impact and be a factor that might mean that they're diagnosed with malnutrition. Right. So why do we worry about malnutrition? There's lots of different reasons, and there's a lot of growing evidence, and it's one of the reasons that I became a dietitian working with people with cancer was to help support them during treatment to prevent and treat malnutrition. So it increases the toxicity of treatments, which means people are more symptomatic on a treatment if they are malnourished than someone who is not. It can interfere with treatment, sticking to a treatment regimen, which means that if you're not getting as much of your treatment, it can affect, obviously, things like survival or ability to cope with treatment. People can be in hospital for a longer time, increased length of stay, or have more infections, slower wound healing, or slower to recover from things like radiotherapy or other treatments. It can cause fatigue and decrease the ability for someone to have a good quality of life during their treatment. So ultimately, there's lots of different things that we want to prevent if we can, malnutrition, but ideally identify it as early as possible so that we can get some interventions in to help support and limit the effect and that someone might have if they have malnutrition. How might you know if you're malnourished or you're at risk? So I put a little weighing scale here. As often, weight is one of the first signs. A weight change can be the first sign that you might have malnutrition or be at risk of malnutrition. But whilst it is obviously something to monitor, and I'm sure that you will probably be your healthcare team, that might be something that they monitor, it doesn't always give us the full picture. So these people have the same weight, but the person on the right, you'll see they have a lot more muscle mass in red. So that's the red muscle, especially around their sacrum and all around their core. Really, they've got that strength compared to the CT scan on the left, where there really isn't as much. So weight is only an indicator that we might want to do some other investigations, but it can really be something that if you go all by the weight without listening to other symptoms that you might have, it can throw things off and actually mean you're more at risk. You're more at risk there. So it's not all, and actually malnutrition comes in all shapes and sizes, and whatever shape you start your treatment, the majority we want you to stay that shape, and effectively we might want you to move. We might promote muscle growth, but that's the kind of thing we're usually not, very rarely promoting weight loss during treatment, as it often results in muscle mass loss rather than any sort of total fat loss or body composition change that we might promote. This is a little bit of a busy slide, but I did put it up here because it's generally what a healthcare professional or a dietitian might do. And I just wanted to take you through some of the ways that we might assess and screen for malnutrition. So we obviously do use weight, but we use food intake. So any changes to food intake, especially if you're changing the texture of your food. You've got nutrition impact symptoms down in box 3 on the left. And I know you might not be able to see these. So these are things like no appetite, nausea, constipation, sore mouth, problems swallowing, having pain, vomiting, diarrhea, dry mouth, smells bother you, you feel full quickly or early satiety. We might also say you're fatigued or very tired. You might have depression, isolation, or money or poor dentition. They're all things that are assessed, and they often are called nutrition impact symptoms. And we also look at the functional status of yourself. How are you getting around? Can you do the normal stuff that you would normally do? Other things that you can look at is if you have changes to the way that your clothes fit, if your rings or your jewelry might change. So they're little things that you can look out for in yourself, especially if you don't always want to weigh yourself, and it can actually be quite triggering for some people to weigh themselves, especially when it happens quite a lot in the hospital. So those kind of things can help you know if you might be at risk of malnutrition during your treatment. Like I said at the start of the session, many people, especially coming into breast cancer treatment, usually feel quite well. then a diagnosis comes along and throws everything around, and it can then cause some pre-treatment things that might affect your intake. And then we also give you treatment, and generally those treatments, they have side effects, whether it's surgery, whether it's chemotherapy or immunotherapy, then it might be radiotherapy and another chemotherapy. There's a long treatment line for some people, and all of these at some stage might affect your nutrition. So what I'm going to do is take you through some of the common nutrition impact symptoms that I see and give you a few strategies to help. This isn't going through each of them. There's still quite a few. I'll probably go through some in session 4 as well, some of the extra ones, and just because they can affect people with different treatments. And most of the immunotherapies are often used for people with incurable but treatable breast cancer. So I'm going to talk about those in session 4 as well, because they come with a different set of nutrition impact symptoms. So one of the most common ones that we see is loss of appetite, and in sciencey literature, this is referred to as anorexia. So it's not the eating disorder anorexia nervosa, it just means loss of appetite. So if you ever see that written, you can see on the left here, there's lots of different causes of a poor appetite. Most systemic anti-cancer treatments, so by these I mean your chemotherapy, immunotherapy, targeted therapies, if you're taking a tablet, they can cause a loss of appetite. So there's lots of different things that can cause that. There's also, let me start that again. I've included the medical treatment before the nutrition strategies because when you're having treatment, usually you need some medical treatment to help support the nutrition impact symptom before I could tell you all of these things about how to eat better. If you have a loss of appetite due to nausea and you don't take an anti-sickness tablet and you eat, you probably feel more sick. And I could tell you all these different things to eat, but until we manage to get on top of that, what symptom is and what it's caused by, it's real challenge to actually boost your intake. So that's why I've always put the medical treatment first. As we know, within our treatment, when we're having our treatment, there's a whole team of people that look after us, and that's leaning on our medical team to ask, or our pharmacist, or if you do have access to a dietitian, these would be the things that they might go over. One of the main things that I often tell people during treatment is if they're struggling with appetite, especially if it's at different times of their treatment or overall, is to relax the traditional healthy eating. So this can seem a little bit backwards, and sometimes an oncologist or a doctor might give you a blanket, eat whatever you want kind of statement. And I know I spoke to Chandrika about this before. It's not always helpful to have that sort of blanket statement about eating anything or everything, especially when you don't actually feel like eating. If you're relaxing what you would normally call a healthy eating, or even if you were striving to eat more traditional healthy, what we're wanting you to do is strip it back and focus on things that are high protein and higher energy. And I'll talk about some of what that is after I've gone through all of these. So again, protein is the priority. If you're struggling, it's having that first. Flipping things around rather than having a big meal, having smaller portions, but more often. If it's easier for you to eat breakfast, it might be that you have a little bit more breakfast and tailor off during the day. So sometimes it's a little bit different to what we may have done before cancer, and it's looking at ways that we can really optimize your intake. Having nourishing fluids, milk, different dairy milks or alternates for a drink can help. Smoothies, soups, casseroles. Having liquid and food can sometimes make it a bit easier for you to eat, but don't want to fill up on things like water. So when I say consume liquids between meals, it's making sure that you're not knocking back a glass of water or something and then not be able to eat just because you know that you've got a poor appetite. Obviously, these strategies are really important. You can give them a try, but if you're struggling still after implementing a few of them, that's when you need to refer on. Ask for some support from your team, ask for a referral, because there's lots of different things that then a dietitian would be able to go through with you to help support your intake. some fluid for myself. Okay. So taste changes is one of the most commonly reported symptoms that can come with cancer treatment or cancer itself. But it's one of the hardest ones to actually treat. I always say try and find out the cause. So some people, I haven't actually put it in here, may have oral thrush. That can cause some taste changes as well. That's common with some cancer treatments. If it's another cause like smoking and alcohol, it might be addressing that. But for most people, nutrition strategies, it can be flipping around things where you might eat things a little bit different, might favor sweet foods, and that's okay, because again, it's not forever. And if it's helping you eat your you might be focusing on dairy or puddings, those kind of things that are going to help boost your intake, that's okay. So it's that permission again. Trialing different flavors, you might end up liking a stronger flavor food, more chili, more garlic, or less, very bland flavors, plainer foods. And that's all right. It's just sticking around with different things and different flavors, utilizing, again, your herbs, spices. You might add more salt or sugar. And that's okay, again, because it's a short-term thing to make sure that you're eating well to get through treatment. So the changes that can come with high sugar or high salt diets are longer term. So it's not something you need to worry about for getting you through, to make sure we're preventing or supporting your nutritional status. Nausea and vomiting, another common one. And generally we're looking at medications here. So antiemetics, that means anti-sickness medications. There can be a cause, and very often I see constipation as being a cause for nausea. Some of the medications, and I'll come to that in a moment, can cause constipation. So it is seeing what your bowel function's like, and if it's making you feel a little bit off, sometimes it's just helping support that to make eating a bit easier for you, so that you can manage that symptom for you, because it really is an impact to your nutritional status with nausea or vomiting. Sometimes it's the timing of medications as well. So if you're having anti-sickness medication before meals, so that you can eat things a little bit easier, again, rather than necessarily even changing what you're eating. So diarrhea and constipation are the two that I'm doing next. So diarrhea is a complication of many cancer treatments. One of the main treatments, again, is going to be medication. I've spelled medications wrong in the second line there, sorry. Things like loperamide or Imodium might be a prescription for codeine. Those kind of things can help treat if you need some medication for diarrhea. There's no evidence to support a low fibre diet with diarrhea. But we can manipulate fibre. So we can add in things like soluble fibres to help bulk stools. Often people will come into breast cancer treatment with already having a diagnosis of irritable bowel syndrome or inflammatory bowel disease. And again, I would always lean on your professionals that have been supporting you, so that hopefully if you have any additional symptoms, it can be addressed quickly. Some people do get a transient, like a short-term lactose intolerance if the treatment, like a chemotherapy, has damaged their gut lining, which is one of the reasons why we do get some of these gastro side effects with cancer treatment. So a low lactose trial might be something that you do trial. Again, you're not wanting to exclude for too long, and that's when you would ask for a referral. If you're struggling to work out what might be triggering you, that's sort of what our job would be to be able to work with you with a food diary and be able to see if there was any triggers, or if it is treatment related and we can treat it in other ways. So if it is something that's affecting you, it can really impact how you want to eat and your quality of life. So if that's something that you're suffering with, we definitely want to support. And constipation is the last one that I'm going to talk about today. So constipation, like I said before, is something that I see a lot with people undergoing breast cancer treatment. It's common partly because we're better at managing the other symptoms. So some of the nausea, some of the vomiting, we now have some really great drugs that have been around now for a while, but they can really cause constipation. So if it's medically induced constipation, so if it's one of your anti-sickness tablets or if it's a painkiller that might be causing constipation, we always recommend medication to help because diet isn't really going to help that medically induced constipation, and it can take a lot longer to clear, and you can really be impacted on your eating and ability to eat well and have a good quality of life during your treatment. That being said, though, there are some things that we do with increasing fibre with our diet. So those plants that I mentioned earlier, making sure you're well hydrated and optimizing physical activity. So that's, again, something that fits in. And I talked a lot more about physical activity in the first session. It really goes along with knowing that it can boost our health and support our body during our treatment. So the prehab principles that I spoke about in the first session definitely carry over into during treatment. And we know that physical activity and exercise is really important during treatment to help support our bodies recover well. So this was stolen from Dietitian Connection. So I'll put the little link down the bottom. If you just Google high protein, high energy diets, you'll come up with a whole wealth of ideas online now. But you can see here, there's lots of different options, and it's sometimes just making a few tweaks to your diet if you're struggling to eat normally, to switch to things that are a little bit more high energy and high protein, using fats a little bit more generously, and making sure that you're having sort of a protein source with each meal, like your beans on toast, cheese and crackers. Those are still a great combination for a meal if you're struggling. And the smoothies is the other sort of key. If you make it with some sort of protein source, you've got your fluid in there, and then adding lots of different nourishing things in there that can really help support your nutritional intake to make sure you're meeting your needs during your treatment. If you're still struggling, so you've sort of followed some of the first line advice that I might have spoke about today, you've had a little, fiddle with your diet, and you've included quite a few of these different things, then that's really when I suggest that you reach out for some support, because it's not something that you are meant to be able to manage yourself. That is why you've got a lot of professionals around you that can really help support you to be well nourished during your treatment. But hopefully being aware that early support and early intervention can help keep things as they are or improve them, rather than sort of losing muscle further down the line and actually struggling to tolerate treatments, or do the things that you really want to do during your treatment, and can affect how you recover from things from there. Okay, so that was a whistle-stop tour through eating well with breast cancer during breast cancer treatment. So hopefully you can see the sort of normal eating is around sort of a Mediterranean style or traditional style eating. And I do talk about that a little bit more in session 1. And that's really helped support your immune system. It almost can be called that anti-inflammatory diet, which I think a few of you are keen to know a little bit more about, which is making sure that we're including those really good fats in our diet, lots of colours, eat the rainbow, those kind of things. It all fits into that, and what is to eat well during cancer treatment, but with a specific protein as the priority. So hopefully that was clear, but please do ask any questions that you have about that section. But this next bit is about one of the fact and fiction. So there's a few things I'm going to cover in this little section, but a lot of them are around sugar feeds cancer as a question. Does it? What's the evidence? What do I tell people? And what does it mean for you? So fact or fiction? So sugar feeds cancer. So where did this come from? It's something that I get asked a lot, and the answer isn't simple, because sugar cancer does use all nutrients to grow. So I think that's the first thing. But what it means is, if sugar is used by our cancer cells and metabolized by our cancer cells, does that mean reducing sugar or excluding sugar in the diet can be therapeutic, meaning can shrink or starve the cancer cells? And that's what we're going to have a little bit of a deep dive into. So on the left here, you'll see this is one of the original hallmarks of cancer that's needed for cancer to grow. So it's not just one thing that happens. And even I've got another slide that includes more ideas around some of the evidence and growing about what our tumour and the microenvironment around there, what it needs to grow and develop. So this is a field that is ever growing, but a lot of these things become then targets to treatment, and we'll talk about that in a little bit more detail. So there's also the scan on the right here. So that's a PET scan. So this is one of the things that people often have, where you will have a glucose infusion and then they will scan you. So it's a radioactive glucose, put you through a scanner, and then it actually can show the radiologist and your cancer team, your professionals, about where the disease might be in your body. So it's something that is used in diagnostic and staging for many different types of cancer. But it actually has been like a, wow, does that mean that sugar feeds cancer? So our cancer cells do metabolize sugar, and they do metabolize it at a faster rate. But does that mean that we need to exclude it? What does that mean for our eating and our diet and how we cope with that? So this is what I found last night, doing a little bit of a deep dive again into some of the evidence, and it is growing, the sort of emerging characteristics that we see when it comes to cancers and cancer development. I'm not going to go into too much detail because it is very complex and it's another speciality, and it's something that I use, though, to show where we might be able to use sort of some of these theories that come about when it comes to nutrition. And some of it comes with some of the ways that the tumour might get energy and nutrition. So some of these might be the red section, where we're inducing vasculature, which is effectively blood supply. So it's how the cells then get blood supply and nutrition. So there's some things around that we might be able to look at. And the deregulating cellular metabolism. So this is sort of where we've got the sugar, and the messaging around that comes in. So bear with me. So what's the evidence? So when it comes to sugar, it's still not as clear cut. So sugar itself is obviously a glucose molecule. There's 3 different types of sugar. Sugars that our body uses. They use them for energy. Then we've got longer chains of sugar that join together, and this is a carbohydrate. So carbohydrates are found in plant-based foods. And what we know as the growing evidence is that actually plant-based foods before and after cancer are a good idea. They're shown to reduce the risk of cancer beginning in the first place and coming back. And I'll go into that in a little bit more detail in the next session. So it's not as simple to be able to say that I'm going to cut out everything that's sugar, as it kind of goes against some of those other guidelines that we have, where we're wanting to have sort of plant-based foods. And I think a lot of people refer them as whole foods, but it doesn't necessarily mean you need to make any exclusions. I wanted to talk to you a little bit about some of the evidence, though. So there is some studies that are looking at a keto diet, which is where you restrict carbohydrates so low that your body uses fat as its main substrate for energy. Most of this has come from some of the work within brain cancer. So there is some studies going on with a keto diet, and they're working out if it's safe and if it's feasible within certain types of brain tumours. So those studies are ongoing. When it comes to breast cancer, it's a little bit more flexible, and we're promoting more of again, similar traditional eating, those whole foods for the majority of people. And that's really where the advice goes. So it's looking at I mean, actually, that was one of the things that we spoke about before with Chandrika, the glycemic load. So how much carbohydrate are you having? So the majority of us will eat a meal which contains lots of different components, and with priority to protein, that will always slow the absorption down. So we're not going to have big sugar spikes as we go through treatment. The one thing, though, I do want to add is that if you are focusing on sweeter foods because you're struggling to eat, that is still the best option for you. And that's where nutrition isn't as clear cut. And there's so many nuances around eating well during your treatment. All of the studies that are ongoing, so there are some studies on different types of modifications when it comes to protein, carbohydrate, and fat, are adjuvant. So that means alongside cancer treatments. So they're looking at different dietary regimens alongside cancer treatments. So there's one that is looking at fasting 2 days before, 2 days after. And that's actually a low protein, low calorie. So they're not looking at carbohydrate, they're looking at overall calorie and how that can affect someone's side effects, which are often nutrition impact symptoms. So that is a study that's ongoing. So we're still waiting to see if that's going to be something that we might change. All of these things, though, if they're done to an extreme without the support, you run the risk of malnutrition or sarcopenia, which then does have those real delays that can affect your treatment and affect your ability to cope with it. So it's not as clear cut as I would like. And I wish I had more answers for you to be able to say that this is the right way of eating. But what we know is that if you cut things out of your diet, what it's more likely to do is impact on the treatments that we know work, rather than being able to be something that might provide something special or that we might be able to do. So do reach out to your professionals. And as long as, I'll often work with someone or have worked with someone to explore different ways of eating during treatment that will help them if they want to try something, but minimize the risk of the knock-on effects like malnutrition or sarcopenia. So those kind of things are being pragmatic with us and how we can help support you to see and explore what you may want. So it's not as easy as me saying yes or no. It's definitely working out for yourself what is important when it comes to that, and knowing that a lot of the evidence is moving towards that protein, more plants, and that's sort of where we want to start as that basic, what do I need to eat to keep well during cancer treatment. Make sure I've said everything I wanted to say in my little section. Yeah, okay. The other thing that I think is a little bit interesting to put on when we're looking at the sort of metabolic ways that breast cancer is that it gets its energy is there's lots of different treatments now that are targeting these pathways. So they're targeting the formation of new blood vessels or things like that, so that it's actually cutting out the nutrition that way. So we're eating what we want to, but these drugs are blocking that getting to any nutrition, vitamins, minerals, they need it all. So that's the sort of thing that we're looking at, some of these interesting metabolic pathways to be able to help move across and maybe change the way that we can treat cancer. Okay. So I obviously have a long list of things that I can talk about with things when it comes to questions, as I've still got a long list of them. But what I really want to focus is on what you guys wanted to know today, because I can always get to those a little bit later. Before I stop sharing my screen, I did want to say, if anyone emailed me after the last session, my email had been down for 3 weeks. So if you did get a bounce back, it is now working, and my apologies if you had wanted to ask anything specific. Okay.
Thank you, Adele. You've covered a lot and very, very interesting. There is a question for you in the Q&A box from Donna. Donna wants to know where to find information on the amount of protein in foods. Is there a good source of information?
There is, and I did think I had that on my notes. So if you Google high protein diet, and then Nemo, which is the Queensland dietitians. They have a range of information leaflets that all dietitians around Australia use. And they have one that's called Getting the Right Amount of Protein. And it's got a long list of things on there. So you can actually work out what's in food, how much you're getting, how much you need, and it can help you top up if you need to. So that is a great question because it's an important thing.
I just typed Nemo in and I spelt it like the children's movie.
Exactly.
Is that correct?
Yeah, that's right. I can't remember what it stands for, but it's a Queensland dietitians, and we all use them because they're updated regularly and relevant information. So there is a wealth of information on there. There's high energy, high protein information, different healthy eating things as well. So it is a great resource that we all benefit from. Definitely. I didn't get as much in the chat today.
You still have time, folks, to pop your questions in if you have questions for Adele.
You do.
I've got a question for you, Adele.
Go.
Well, we've talked about this offline before. So I'm a long-term vegetarian, and I think that I get huge amounts of carbohydrates, and I do think about protein, but all the protein sources that I choose typically are also carbohydrate sources.
Yeah.
So like lentils and beans. Is there any issues with that around the glycemic load?
So your body would probably be well adapted to the types of foods that you eat and your glycemic load. The benefit of those plant-based foods, and something that I could have dropped in as well, is the fiber. So other nutrients slow the absorption of other nutrients. So fiber, fat, protein will all slow that absorption down. So it's not going to be something that's going to give you a big energy rush or anything like that, like you say. So
I can see a couple more questions. Thank you. That's good. I like to think I'm on the right track, but I also am really conscious that, lentils and rice, I'm having like a lot of carbs, but anyway.
And they are, and there's no the messaging around that is sometimes a little bit negative, that, oh no, I'm having too many carbs. But when we unpick the evidence, they're both plants, and plant-based eating overall is a great thing to include. So it is just some of the messaging around that I don't think is the greatest.
Yeah. So one of the questions in the Q&A box is kind of the opposite. Bahare is saying they're type 2 diabetic and has breast cancer and on a mostly carnivore diet. What kind of health impacts are we looking at there?
So I would say during treatment, we are a little bit more relaxed when it comes to some of the evidence around risk of reduction when it comes to breast cancer. So in the next session, I'm going to have a deep dive into what's the best after treatment, because actually during treatment, that's probably a great way to eat. It's going to mean you're easily getting your protein. And in the short term, the effects of animal proteins aren't going to have a negative effect, but there is growing evidence on the effect of longer term those kind of foods. So if you're moving into after treatment, that's where we might want to swap some things out. And I'll go into that in a bit more detail in the next session, or quite a bit more detail on what the evidence is after treatment, because it's there's a lot more stronger evidence for that.
For plant-based eating.
Plant-based, yeah, or less just thinking about different types of animal proteins as well. So less red meat, those kind of things.
Right. Okay, good. Yeah. And Jenny also has an interesting question. How important is it to avoid high estrogen foods if you have estrogen receptor positive breast cancer?
So that's a great question. And it's something that, because we had been worried about it for a while, it was a fear that estrogen similar foods, so often phytoestrogens like linseeds, flaxseed, that kind of thing, we thought, and soya falls into this too, that they would bind to an ER positive and be a promoter. So as an estrogen would be. So we were worried that it would promote. But actually the evidence is showing that that function isn't happening, and it seems to be acting more like a blocker. So they are safe and actually recommended. So it's a good thing to add in those types of foods. And the evidence grows afterwards as well, which I'll talk in a bit more detail about soya after treatment, which is one of those things that we're realizing is a benefit. So it's not something to fear.
Okay, so those phytoestrogens, they're much
Mhm.
weaker, aren't they, than a
Definitely.
naturally
And
occurring estrogen?
they don't seem to work in the same way. So all the evidence that for people, what we do is we look at people who eat lots of soya and include linseeds, and actually their rates have reduced. So we're confident that it's safe, and there's a growing body of evidence to recommend those foods. So that's a big change when it comes to some of the guidance around that, which is a good thing. And that's a prime example of how, as we research things, we understand a bit more about the risk or not benefits, and modify our advice. Dairy's had the same approach, actually, because we used to worry about dairy, but the evidence is showing that it's safe, and is protective for some other cancers, protective against bowel cancer. So it's interesting, as we research things and understand a bit more and grow, we can actually safely and confidently have people who want to eat those foods. Obviously, if you don't like dairy or don't want to eat it, then that's absolutely fine as well, as long as you get any calcium.
I think that's all the questions from our audience. I've got so many more nutrition questions. Can I ask you one more?
Definitely.
So I noticed that you had in your slides about some zinc supplementation, but being questionable during treatment.
Yeah.
Is that about the antioxidant or about supplements generally? Can you explain?
Yeah, so that's another good question, and something I've wanted to cover in a bit more detail is the whole supplements during treatment, because it's something that I get asked a lot. Should I take supplements? But actually, the advice is to stick with normal eating during cancer treatment, unless you have a deficiency. So it is maybe focusing on making sure you're getting sort of that balanced eating. If you're worried that you're not eating normally, then that's when you might want to explore supplementation with a professional to see if you're worried about anything. And then there's some people that will already have a prescribed supplement. Calcium and vitamin D is a common one. Iron supplements might be something that you're on. That being said, though, again, a lot of professionals and your doctors may be more pragmatic about it. So I'd always suggest that you ask, because we know that people are taking different supplements. And I would much rather be able to say, hold on, let me just see if there's any real risk that I can see in the evidence, or chat with the oncologist to be able to say, look, this person wants to try this. What do you know? They know your specific drugs, as do a pharmacist. So they're a great resource to share, because ultimately they're the ones that can really help you understand. And what we want to know is if there's any risks of interfering with your treatment, because there can be some risks, whether we or worried about risks. So that's why we're a little bit more cautious during treatment. But I'd always just be honest and let them know that, it is your body. And if it's something that you are taking, if you can ask them for their, a lot of people, there are some things that they will say, that's fine. Yeah. Or they'll say, no, don't take that. Like, what else have I been asked about? Apricot seeds, those kind of things, where, people want to take these things because it sounds like it could be something that would work. And yeah, it could be a bit risky.
Okay. So, sorry, I heard something beeping, but it's not
It's
in our
me.
meeting.
It's all right.
Oh, it's you.
It's mine. Sorry. Someone's trying to get into something after this.
Well, I feel like we've done really well today. We're just at our 1 hour mark.
Mhm.
Are you happy to finish up here, Adele?
I am. I'm thinking if maybe we can work out a future way, because there is loads of other topics I could delve into, but I think to do them justice, it helps to understand a little bit more about where they've come from. So I think we can maybe talk about some of the ones we might want to highlight for the next 2 sessions, and move forward from there.
That's great. Thank you. And so for those of you in the audience today, if you do think of other things that you would like Adele to address in the upcoming webinars, you can either contact her directly or you can contact Breast Cancer Care WA and we'll pass on your questions. The next 2 nutrition webinars are July 24th and August 7th. But before we come back to Adele on those dates, we also have a webinar next week, June the 12th, with Professor Josh Wiley on sleep. That should be very interesting. And on June the 18th, we have the fabulous Sue Woodall from Live Work Cancer talking about returning to work. So I look forward to seeing you online then and around the campus if you're here in the Cottesloe area as well. Thanks again so much, Adele, for sharing your knowledge.
Thank you. Bye, everyone.